Hello, practicing medicine in the UK means being required to observe the good medical practice and the ethical guidance for doctors which is written by the General Medical Council, the GMC. This is unique to the UK, and every health system around the world might have a different ethical guidance. So it's important for us who would like to practice in the UK to be familiar with what is written by the GMC. Situations which are covered in the guidance include things like confidentiality, consent, decision making, end of life care, and dealing with children and young people and others as well. Almost every consultation might bring an ethical dilemma that can be related to the guidance. But there is a difference between knowing what the ethical guide for a certain situation is and applying that knowledge in practice. Applying that knowledge in practice is more sophisticated than just telling the patient our duties as doctors is to do X or not to do Y in this situation. It actually requires the skill of situation awareness, the skill of having sensitive communication with the patient, prioritizing what information to give to the patient and how to give that information. For example, the guidance would say you must be honest and trustworthy in all your communication with the patients and colleagues. But remember, while we are required to be honest with the patients, we should also be sensitive and choose the appropriate way of communicating that honest information. And that is what we are actually going to talk about in this brief video. I'm Dr. Ibrahim and I'm a TPD in Coventry and Warwickshire, VTS, and a GP as well. Now let's have an example for the difference between applying this guidance in practice. Mr. Singh has a telephone appointment, and when the doctor rings, the daughter answers the phone and says that she booked the appointment for her father because she wants to discuss some of his health problems. She's now outside home and her father is home. Now the doctor looks at the records and there is no prior consent that is written by Mr. Singh to discuss his health issues with his daughter. Now, three different doctors might respond differently. Dr. A, for example, immediately says, sorry, I can't discuss your father's health problems with you because of confidentiality. The doctor becomes angry and the rest of the consultation is full of hostility, intimidation, and arguments. Dr. B might have a different response. Dr. B listens to the daughter and tries to carefully answer her questions without giving any information to her from the records. And then the doctor decides on the management, which might involve, for example, booking Mr. Singh back into the surgery or ringing Mr. Singh again on a later time. Dr. C might have a different approach. Dr. C says to the daughter, yes, sure. When will you be home for me to call you back whilst Mr. Singh is there? The daughter transpires that she will be home in about half an hour, and after half an hour the doctor rings back and there is the consultation would take place between the three of them. Now let's think of these three doctors. None of them actually did breach any confidentiality. None of them did the wrong thing. But Dr. C started by showing practically his or her willingness to help whilst observing confidentiality. So this is the important. Putting things in practice means putting the patients first, providing the friendly advice to the patient, showing that willingness to help the patient whilst observing the confidentiality and all the ethical guidance. Take decision making. Putting decision making in practice requires active involvement to support the patients. We all know that patients have the right to make decisions, but actually it takes more than just allowing patients to make the decisions, to apply the ethical guidance in practice. We should try as much as we can to support the patient in making that decision. And it doesn't mean just giving them the information. It also means tailoring the information to what they need to make that decision, putting their individual circumstance in the context, putting the giving them the information that would help them to make the decision that is suitable for them. The GMC has 7 principles of decision making and consent, which you can have a look at the GMC website. Now, there is another way of applying decision making, applying the ethical guidance into decision making, and that is what is known as Johnson grid, or the 4-quadrant approach. And what does it mean is actually the 4-quadrant, it actually suggests that these following questions should be worked through in order. The first is, what is the indication for the medical intervention? What is the diagnosis? What are the options of treatment? What are the prognoses for each of the options? And the second thing is, what does the patient prefer? Is the patient competent? If so, what does he or she want? If not competent, then what is in the best interest of the patient? And then we move to the third question, which is the quality of life. Will the proposed treatment improve the quality of life of this patient? And then the last thing is to put all this in context, the contextual features, which something like, does the cultural background of the patient have any role here? What are the religious or the legal factors that have an impact on the decision making? And there are other considerations to put in mind when we try to apply the ethical guidance in reality and in practice. For example, the impact of COVID-19 on ethics guidance. If you look at the GMC website, there is no new guidance during the COVID pandemic. The same guidance, there are advices on how to apply this guidance in the light or under the circumstances of the pandemic. Let's take an example. For example, children, dealing with children. If a child comes to you asking for the vaccine without their parents, can the child consent to the vaccine or not? Now, we all know that the GMC states clearly that young people aged 16 or over can consent to their treatment, and they are presumed to have capacity to do so unless there is an evidence to the contrary. Children under the age of 16 can consent if they are deemed legally competent, which means they fully understand the nature of the treatment, its purpose, and the possible consequences. So if a child comes wanting the vaccine, we would apply that in practice. However, before just applying the legal competence, before just allowing them to make the decision or not, we would like to take a step further and try to bring the views of the children and the parents together, and so we have that decision made, and we don't need to go further into having the child to make the decision and the parent having a different decision. In summary, applying the ethical guidance in practice is something that requires the skill, the communication skills. It requires putting the patients First, it requires putting the context, the contextual factors that might affect the decision that we do to our patients. In that way, the ethical guidance doesn't become a barrier in us providing a compassionate, friendly advice to the patient. In fact, it will become always in the back of our mind while we smoothly communicate with the patient and offer them the help that they need. Thank you.